Doctors were told that if they associated with Rife and his instruments, they would lose their license. Doctors who had previously associated with Rife had actually been photographed with him, now denied ever meeting him. There were other incidents, too. Over a period of time, components, photographs, film, and written records were pilfered from Rife's lab. The culprit was never caught. Then, while Rife struggled to reproduce his missing data in a day when photocopies and computers were not available, someone vandalized his precious virus microscope. Pieces of the universal microscope were stolen. Earlier, a fire had destroyed the multi-million-dollar Burnett lab in New Jersey, as the scientists there were confirming Rife's work. It seemed a conspiracy had enveloped Rife, and then disaster. Milbank Johnson, Rife's most powerful ally and respected authority in the medical community, died suddenly in 1944. This was a serious blow to Rife and his postulations. There were other powerful forces working against Rife at this time. After World War II, pharmaceutical interests, partnering with universities and other scientific organizations, began to pour huge amounts of capital into drug research. Antibiotics were billed as a cure-all for the world's health problems. Penicillin was one of the first to be put on the market with much fanfare. Doctors were prescribing penicillin and other powerful drugs to combat disease, and it became a very profitable enterprise. There wasn't much motivation to use an odd and seemingly arcane frequency generation device anymore. The beam ray business faded, and by 1947 closed its doors. Royal Rife receded into depression and alcohol abuse. He felt his life had been a failure. He confided to those close to him that he felt powerless to control his life's purpose, to bring the world a cure for cancer and other diseases afflicting mankind. In 1950, Rife had the occasion to meet John Crane, a tool and die maker who worked for a prominent San Diego aircraft manufacturer. Crane took an interest in Rife's work and encouraged him to begin anew with his research. A new company was formed to build Rife's frequency instruments, Life Lab. 6 newer-style beam ray devices were eventually built, but market forces were working against them. These units were expensive to produce, costly to maintain, and beyond the technical capabilities of most users. Some other solution had to be found. In 1957, a smaller, more reasonably priced, easier to operate version was developed and then put into production. The new device sold for about $200 and soon became popular. Successes were reported. This only fueled more attacks on Rife and his methods, however. This time it was Crane, now the frontman of Life Lab, who received the brunt of the negative reaction. Crane fought back, railing against the powerful forces that dismissed Rife's work and his frequency generator as nonsense. Crane would ask anyone who would listen, what about the 1934 University of Southern California sponsored study concluding a cure in 16 of 16 terminally ill patients? Then, as they do today, the AMA and FDA insisted it was all a myth. In 1961, Crane was accused of selling Rife instruments that he said would, quote, medically treat disease, unquote. He was convicted and spent several years in prison until his release on appeal. Prior to the trial, federal agents broke into Life Lab and confiscated all the equipment, documentation, and plans on the premises. Crane was not allowed access to their records or to demonstrate their equipment in their own defense. Testimonials by people who had been treated by Rife technology were not allowed in court. Upon his release from prison, Crane again embarked on a crusade against what he called the corrupt medical monopoly. The laws of the United States, he said, allow for the treatment of cancer with radiation, surgery, and drugs, and by no